Greetings to all of you who are attending the IFPRI Delivering for Nutrition Summit, whatever time zone you're in today. My name is Peggy Bentley, and I'm honored to be part of the opening of the summit. I'm president of the Society for Implementation Science and Nutrition. Some of you may know us as SISN. We are an NGO that was launched in 2016 to facilitate the vital collaboration needed between all stakeholders in nutrition implementation and to pool the collective knowledge, experience, resources, and commitments of scientists and practitioners to take on the challenge of scaling up nutrition globally. Our mission is to convene, advocate, disseminate, and promote dialogue among scientists, policy leaders, government officials, funders, and practitioners to advance the science and practice of nutrition implementation worldwide. First, let me congratulate the organizers and all of you who are participating in this important annual conference that moves forward and showcases the importance of implementation science research and experience and its potential for impact at a regional and country level. This is a region that has great meaning for me personally. I lived in India for 2.5 years and have worked on research and training there in maternal and child nutrition since the mid-'80s. I visited many of the countries represented today and observed the tremendous capacity for research and implementation. In reviewing some of the abstracts for the conference, we have been so impressed with the wide range of topics and issues and a recognition of the barriers, challenges, and solutions of moving from what works to scaling up. Clearly, the field of implementation science and the frameworks, methods, skills, and knowledge that you all apply to your work is an essential part of promoting and sustaining the nutrition and health of populations worldwide. This conference, which gives equal weight to both implementation research and implementation experience, acknowledges the importance of both and how they complement each other and very often overlap. The attention to global knowledge and experience and to contextual knowledge and experience for conducting implementation research in nutrition is essential for achieving impact at scale. I was asked to briefly talk about the importance of implementation science and field experience for maternal and child health. This is my own field of research and is close to my heart. I am a nutritional anthropologist, and I know the importance of context, geographic setting, and cultural norms that may guide nutrition and dietary behavior. This includes the importance of understanding local knowledge and belief systems and structural barriers that lead to poor or positive health outcomes for women and children, but always in context of where you are on the planet. A key part of implementation research is formative research, and it is an essential part of designing interventions and implementing programs. What works in one setting will not necessarily work in another, and flexible adaptations will be needed. Local knowledge and community-based engagement, shared learning, and participation is key. This is a core tenet of implementation science. Like many of you, I've been frustrated that in many cases we can show efficacy of an intervention through evidence-based research, but the important step of involving stakeholders at the outset, including those who are decision makers for programs and policies at a regional or national level, is often lacking. So we see potential game-changing strategies sit on a shelf. It is discouraging that then we move on to the next great idea. This is no doubt true for all of us. On the other hand, there are many examples of success, moving from formative research through efficacy and then implementation in programs and policy. Alive and Thrive in Bangladesh and the Suhara project in Nepal are both examples of maternal and child nutrition projects that used extensive formative research to inform program activities and implemented initiatives at the household, community, district, and national levels, and both had robust evaluations. This is something that needs to be included from the start. This is an exciting time for implementation science. This conference and the shared learnings that will result have the potential to leap over some of the bottlenecks identified in the region and beyond. While these impressive achievements may appear homegrown to a region, they align perfectly with the view of implementation science that is advocated by SISN. And we invite all of you to visit our website and become members. Our website is full of resources, knowledge, tools, publications, webinars, and more related to implementation science and practice. We very much want to expand our membership in this region and include your research and experiences. We look forward to learning from each other during the next 2 days of the conference and to identifying scientific priorities for us to pursue together over the coming years. Thank you.